be discussing, I will be just introducing it, the topic today, and then Dr. Najia will be doing the types of assessment. Sophia will be discussing the utility index. Muhammad Saleh will be discussing the assessment blueprints, and then Sophia and I will do our closing remarks at the end. Thank you. So, learning objective is by the end of this activity, participant will be able to define assessment and describe the key components of mastering assessment design and discuss the learning objectives, validity, reliability, fairness, visibility, leading um, uh, to better student outcome and more effective teaching. So assessment is an important part of learning. Unfortunately, in this part of the world, it is mostly considered as punishment rather than part of the learning, which is a very unfortunate situation. Assessment drives learning. That's what we always say, but it's not an enjoyable moment for the students. And believe me, till I am now 43, but I still get my nightmares, and that I'm attempting some final year exam or fourth year exam. It's still coming. I have a lot of nightmares, but this is so strong that it's still coming at this age. So this is how painful this process is, and how painful this process was. I think it has improved a lot, but still a lot of improvement needed. Yes, please next. So assessment is educator employ methods and tools to evaluate, quantify, and document learning. So the basic purpose is learning, um, and to see how we quantify it, who is done a lot, and then at the same time, uh, sorry, you can go back to the phone call. Okay, and okay, so academic, and we can see the academic readiness, learning progress, skill acquisition, education needed of student, and it's not a punishment platform. It's as I said before. Yeah, next please. So this is just to give you, my colleagues will be discussing it more in details. But what to assess, we are assessing memory and competency. So it's not one formula for all. So it depends. If we have this cognitive, behavioral, and psychomotor skills. So this assessment should be different, and for these different domains. Otherwise, if you have only one sort of, for example, in oral health sciences, there were only one assessment that was theoretical part. There were only 70 questions. And then I discussed with Dr. Brechna, Professor Brechna, and because we got feedback from the employers that our colleagues, our students in the nursing and allied sciences are very good in theoretical, but they're very bad in practical part. And they were complaining that even the diploma holders are better than them. So when we assessed the curriculum, we found that there's no assessment for the skill part of it. So that's why this slide shows that it should be different to assess different level of knowledge and skills. Yes, please. So how to develop structured assessment is present is not to just student character, appearance, and moral principle. This is the predominant things, and we have seen different incidences, different that the teacher says, okay, we'll see at the end of the exam, and with their own religious belief, with their own cultural issues, and they assess student, and they find it as an opportunity to judge the student for these different otherwise, but in true sense, it's not the objective of the assessment. So reward student appropriately. Evaluation is not a punishment platform. Reveal the assessment objective should be revealed. It should not remain confidential. All stakeholders must be informed of these objectives. And create a comprehensive document. Without proper documentation, the assessment would lack organization. Yes, please. So assessment designs play a pivotal role in education, particularly in our medical and dental education. So because we both have knowledge and practical skills, which are essential for our student success. So mastering assessment design involve creating test, evaluation, and then we have different tools. And this what we are learning here. How to develop a multiple choice question. What should be the stem of that? What should be how it should be designed so that the chances should not win. And at the same time, we should be able to assess the true knowledge and skill of our students. Yes, please, next. So, mastering assessment design requires a deep understanding of several key components that ensure the assessments are valid, reliable, and effective in evaluating the intended learning outcome. So, this is, it's the most important slide of my presentation. It's not, we need to learn it. We need to learn it. The educator should need to learn it so that the assessment should not be subjective. It should be valid, accurate, it should be reliable, repeat itself again and again, giving the same outcome, and it should be effective. And what at the end of the day, we should be able to achieve what our intended learning outcomes were. Yes, so it be outcome based. Yes. So that we have clear objective and outcome based. Student learning objectives or competency should guide assessment. Design should guarantee assessment measures and focus on what students should know, understand, or do after instruction. Assessment should demonstrate these outcomes, which was the objective of the course, and you should be able to assess that. Yes, please. Yes, next, please. So, type of assessment we all know. So, just uh, to refresh your memory, that we have formative assessment, the ongoing one. Then we have the end of this assessment, which we call summative assessment. Not solely the university domain, but it's also the summative assessment within the colleges. But this is the overall and the final. And then this should be diagnostic assessment, and we should determine student prior knowledge or skill before instruction begins. Authentic assessment is focused on real world application, for example, project, case studies, and simulation rather than traditional exams. Yes, please. So blueprinting is important. Is the student should know well before, so they should know content area and skill to be tested, the weightage of each, and the types of questions that will be used. This help ensure a balanced assessment covering all key areas. And content validity is important, so which could be ensure the assessment covers a representative sample of the material. The blueprints helps avoid over-assessing certain areas and under-assessing others. The blueprint give balance to both. So you cannot over-assess, you cannot under-assess. It is a document which is visible to all, and it really help to give the uniformity at both end. Yes, please. Next. So assessment method, we discussed that there should be objective assessment, there should be subjective assessment, could be practical performance-based assessment, we call ASCIIs and ASPE, and it could be portfolio assessment. So this all should be there somewhere in the formative or summative, but we should all these tools, these assessment methods have their own objectives. So all are important and they should be there because especially in the medical and dental education. Yes, please. So gradings are important. There's a lot of discussion around grading in rubrics. What should be the grading mechanism? It should be standardized marking scheme. You cannot introduce your own standardized marking schemes which are not compatible with the national guidelines or with the international guidelines, because the degree which you are given, the transcript which you are given, will go with the student all their lives. So big up to the employment, to the end of the employment period. So there should be the assessment should be standardized, and the marking system should be standardized and should be compatible. The feedback is a problem. We sometimes give formative feedback, but in summative it lacks the mechanism. I visit different institutes and they always complain that the papers marking we don't know how much marks you got. We know that, but where we did bad or something. So there's no feedback majority of the time on the summative. So this university side there should be some mechanism, but then at the same time they say that you should not compromise the question banks, so they keep it sacred. Um, but this is something we, as a medical educationist, we all should know that this is a very important. Uh, if we think that assessment is part of learning, it's not a punishment. So the feedback is important. Yes, please. And student engagement and transparency, authenticity. Students are the main stakeholder. So they should know and they should be involved right from the day one to the end. What in this whole process, and to be honest, they give actual um, uh, feeling of what they are going through. Sometimes which we forgot our own feelings that we do a subjective thing, but this is for them, so they should be there right from the day one. Yes, please. So post-assessment is extremely important. Uh, and item analysis and reflection and adjustment. Um, this is important. This is difficult in the hard copies. This is easy in the newly computer-based exam system. So it's easy. The computer can do it for you. But in the traditional hard copy system, it was difficult, but it's now important, and it will give you the feedback to the examiners, and also will know how the people are performing. So it should not be left tail, or it should be right tail. It should be the middle. This nice curve in which should we have tail, the fat belly, and then to the right side. But that will be told by item analysis and reflection adjustment. Thank you, please. So inclusivity and fairness is discussed. That should be cultural and language sensitivity and diverse learning styles. This should be visual, auditory, kinesthetic. So this is individual, and this is the need of the hour. Adult learning, in which we need to be flexible to include these different adults and design our assessment as per their need. Thank you, please. So my last slide will be is mastering assessment design. It is essential to underscore the importance of integrating key principles such as validity, reliability, and the balance between assessment for learning and of learning. Mastery in assessment design not only provides educators with tools to evaluate student learning effectively, but also supports the development of critical thinking and autonomous learning among students. Effective assessment practices ultimately guide both teachers and learners towards identifying strengths and areas for improvement, fostering a conducive learning environment. Thank you so much for listening to me, and I request now my colleagues to give their presentation, then will we have question and answer session. Thank you for your patience.
Thank you, sir, for elaborating on the basics of the assessments and their significance and the overview. Next, I am pleased to invite Dr. Najia Sajad, who is currently serving as a lecturer in the Department of Community Dentistry at Ayub Medical College, Ahmedabad. She will mainly discussing the different types of assessments. So please, madam, come and join us in the session.
Thank you, Dr. Saleh. Is the screen visible?
Yes, it's visible.
Okay, Assalamu alaikum everyone. I am Dr. Najia and I will be your facilitator for this session and of the Mastering Assessment Designs workshop. And my topic of presentation is types of assessment. Here are some of the ground rules that the participants should be on time, mute their microphones when not speaking, not do multitasking, and do not interrupt other people or attempt to speak over them. Turn their video on, raise their digital hand to ask questions, and use the chat box to give comments. The learning objectives of this session are to define the assessment, explain Miller's pyramid, define and differentiate between formative and summative assessments, define and differentiate between high stakes and low stakes assessments, perform an activity about types of assessment, and choose the right type of assessment to be used in a case scenario. So, the assessment is a very important part of health professions education. It is what drives the learning, and it is defined as a processes employed for both learning and teaching, depicting what the students learn over a course of study and their certification. So, as my colleague discussed, there are many types of assessments. So, we will be covering some of the more important ones. So, every assessment starts with Miller's pyramid, and Miller's pyramid has four components, which is knows knowledge, knows how competence, shows how performance, and does action. So each component of the Miller's pyramid has has types of assessment inside them. These are also considered the types of assessments. They are the For the knowledge, we have questions for fact gathering assessment like multiple choice questions and true and false questions. And for the knows how to check the competence, we do the interpretation and application with matching multiple choice questions, case presentations, essays, etc. And for the shows how, this is basically the demonstration of learning. So we do the objective structured practical examination or the objective structured clinical examination, OSCEs and OSPEs, to assess the students. And then does an action is basically workplace based assessment in which performance is showed when they practice in the clinical settings. So all of these Miller's pyramid basically assesses the three domains of knowledge, which are the knowledge, skills, and attitudes, and uh, goes from the novice to the expert as we go from the knowledge to the action. So my other participants will be covering them these types of assessment more in detail in the upcoming workshops, inshallah. So formative and summative assessments. Formative assessments are conducted throughout the learning process. That is, they provide feedback to the student and educators. For example, quizzes that you can take through the class, you can ask the other students to assess the presentation skills of another students. You can take feedback sessions. You can even, when you are doing problem-based learning, you can assess them with a rubric during the problem-based session. And basically, this is the assessment for learning. And this is not a very high stakes assessment either, it's the low stakes assessment. And summative, as the name indicates, it is at the end of the session. So when the student has passed a module or he has passed a academic year, then before that there's an examination which is called the summative assessment. So this is to make the progress decision whether they will be promoted to the next class or maybe promoted to the next module. So to see which students are passed and which students are failed. So these include the final examination, like we have the professional examination here, licensing examination, end of module examinations. So all these are the types of summative assessments. When we try to differentiate with them, so basically we monitor the learning during the learn assessment is done is formative assessment, and at the end when it is done is summative assessment. So ongoing, it is ongoing. Formative, summative is at the end. Formative is good for feedback and identifying strengths and weaknesses, and that is good for measuring the achievement of the learning objectives. So that is low formative is low stakes, and that is high stakes. And basically, encouragement for the learning is more in the formative, and also somewhat in the summative, but to a lesser extent. And the teacher adjusts the teaching to meet the students' needs. And in summative, that is not very much possible to do. And the role in curriculum is primarily for formative, primarily developmental and instructional, and for summative, primarily evaluative and used for certification or progression. So the next ones are the low stakes and the high stakes assessment. So in the high stakes, we have basically the end of examination. The students have to pass it to progress. In low stakes, they should perform well, but it's not uh, that much important as the high stakes ones. And to evaluate, purpose of the high stakes one is to evaluate mastery or qualification, and the low stakes one is to encourage learning and provide feedback. And low stakes and are administered frequently, maybe in every class, or maybe at end of the class, or maybe in the mid module. And whereas the high stakes is less frequent at the end of the module or the block and professional examination. So impact on the grades is obviously higher in the high stakes assessment. So this is a example. This is an oral biology module, 1 2 3 weeks we have. So low assessments are number 4, which are daily quizzes, which are total to 48. Medium stakes are weekly reviews tests, which are the 16 total, and end of the module is also 16 total. So total data points are 15. So we have to, the most important one is the end of the module exam. The student definitely has to pass that to progress. So you have an activity now. You are given 5 minutes to define and give an example of each of the type of the assessments given below. Write your answer on MS Word file and share in the WhatsApp group. They are the diagnostic assessment, norm reference assessment, criterion reference assessment, self assessment, and peer assessment. So let me repeat. For all these 5 assessment types, you are to define them and give an example. Then put them in the Microsoft Word file and share in the WhatsApp group. If you have any problem, you can please ask a question. You have to give an example of, define each one of them, all 5 of them, and give an example. Put them into an MS Word file and share in the WhatsApp group. That is the task. 2 minutes are left. Please share in the group.
Yeah, slowly. Diagnostic assessment. Norm reference assessment.
Mhm.
वो तो करनी है सर, ये तो कर लें। ये ये reference। 5 मिनट बहुत कम नहीं है? हाँ ना, तो आपने तो, आपका ये जो भाई है ना, ये बड़ा चालाक है। क्राइटेरिया ऑन रेफरेंस असेसमेंट।
Repeating the activity once more for those who don't understand, you are required to define and give an example of diagnostic, norm reference, criterion reference, self assessment, and peer assessment, and share them in a MS Word file on the WhatsApp group. Please kindly wrap up in the next 2-3 minutes.
सेल्फ असेसमेंट क्या होती है सर? और पियर बाय फेलोज स्टूडेंट्स। जी सर। सर आप मुझे असेस नहीं कर रहे, आप मुझे नजर लगा रहे हैं। फिर मुझे टेंशन होने लगती है, फिर मेरी नजर ही चली जाती है। 78 78 78। हाँ जी सर। क्या हो गया मैडम? बस मैडम टॉप करेगी। मैडम तो है टॉप को वाले। यार बच्चे
Okay, I'm getting a lot of responses. Good job.
पूरी तो ऐसे। कुछ भी नहीं बनाया सर, तंग ना करें अभी मुझे। मैं पहले ही फेल हूँ। मैं एक वो कर रहा हूँ जो मेरा भाई काम नहीं कर। हाँ हाँ उन्हीं में वही थी जिन्हीं मेरे यार ये मैडम तशी दगा खैरातून काय तपास आहे टोच तर वजी ना आता हाँ हाँ
Okay, moving on. You can share while I proceed. So basically, what we learned from this activity is that diagnostic assessment is done before for
सर कुछ
student
कह रही है
learning,
मैडम
before something is taught, like before a workshop you can do a pre-assessment before a workshop. That is an example of a diagnostic assessment. And the norm reference assessment is the assessment which is related to a group of people. For example, in the FCPS exam, how well the students perform, according to that they are either pass or fail. And criterion reference assessment is, for example, you have to score 70% of marks to pass the examination. Self assessment is your own assessment for your own self improvement, the students can do it themselves. And peer assessment is that the if, for example, a student is giving his presentation and the teachers and the other and the colleagues are giving him assessment on how he did his presentation skills. So now moving on, we have some case scenarios that we are going to discuss, and we'll see what is the best type of assessment suited to that case scenario.
मुमताज तो ठीक
First
था
one is, can someone read it out for me?
You are teaching first year dental students about the anatomy of the oral cavity. You want to ensure they understand the basics before moving on to complex topics like pathologies. Your goal is to reinforce foundational knowledge and identify areas needing clarification. What is the recommended assessment type?
Or types, it could be many types also. Please, anyone?
Diagnostic. Diagnostic.
Anyone else?
Norm reference.
Anything else?
As there are students, so there could be peer assessment as well.
Diagnostic assessment.
Diagnostic ही आएगा.
Formative assessment.
Most probably diagnostic.
Anyone else?
I would go for formative assessment or assessment for learning.
Yes, sir. You are right. It's formative assessment and also low stakes assessment. Both of these types can be done. It's not diagnostic because your goal is to reinforce foundational knowledge and identify areas needing clarification. This is the point which tells you that it is a formative assessment.
तो डॉक्टर नाजिया इसमें ये चीज नहीं है कि आप ये चीज असेस कर रही हैं कि व्हाट दे ऑलरेडी नो, ठीक है, एंड व्हाट दे आर सपोज्ड टू नो, तो ये डायग्नोस्टिक इस तरह का नहीं है इसमें.
तो आप टेस्ट
That
ले रहे हैं तो अगर ये
formative
लेक्चर के दरमियान में कुछ भी
topic.
नहीं उसका जो गायनी के जो गायनी 9 के नाम ऑब्जेक्टिव वो जो लेक्चर है ऑल ऑफ दिया
इसको हम ऐसे
You're
ले
already
सकते हैं कि
teaching it.
diagnostic.
You're not doing it before that. You're already teaching.
ओके,
Yes.
ठीक है, दिस इज ड्यूरिंग द टीचिंग.
Yes, during the teaching. That's why.
recalling the third point also to recall the knowledge of the line and
Should I move on?
yeah.
Okay. Second one. Can someone read it out, please?
You need to assess if a graduating student is ready for independent practice by evaluating their clinical competencies and overall knowledge. Your goal is to confirm that they meet the required standards for patient safety and independent practice. What is the recommended assessment type?
ये तो summative हो गया फिर।
Summative.
High stakes summative or norm reference to this CPS का.
Criteria referenced.
This is summative assessment.
Also,
Competency-based assessments are usually summative.
I would go for summative assessment of learning and even high stake assessment तो ठीक है.
Yes, sir. Norm or criterion इसलिए नहीं है because it is not mentioned that there is a criteria or there is a group being mentioned. अगर वो इसमें बात होती so then it would have been norm and criterion or anyone else. But it is not mentioned here anything about that. So
I have one question. If the criterion based or norm based is a type of assessment or a standard setting?
it's also considered a type of assessment.
Correct.
Actually, anything with assesses, even MCQs are types of assessment. Anything जिससे assessment हो सकती है वो type of assessment ही है. There are various classifications that you can do, but they're all types of assessments. So next scenario is, please read it out.
In a clinical seminar, students present complex cases to their peers, and you want to encourage critical reflection on their performance. Your goal is to develop in the student self-awareness and reflection and provide constructive peer feedback. What is the recommended assessment time?
Self-assessment.
peer assessment.
Peer
assessment.
Peer assessment.
Peer assessment.
Low stakes formative.
Anyone else?
सर ये peer है. हाँ?
Both self-assessment and peer assessment.
That's order तकड़ा है.
Hey, Dr. Najia, I have a question.
सर्जन
Yes.
चढ़ा रखा.
अभी जो हमने इससे पहले वो डेफिनेशंस पढ़ी थी ना डिफरेंट टाइप्स की कि डायग्नोस्टिक असेसमेंट है और वो जो 5 डेफिनेशंस के साथ हमने पढ़ी तो ऑल दीज असेसमेंट टाइप्स ईदर अ टाइप ऑफ फॉर्मेटिव और समेटिव असेसमेंट
Actually,
समथिंग
formative and summative are different types of classifications. So assessments जो होती है ना अगर आप देखें उनकी डेफिनेशंस बहुत सारी डेफिनेशंस में से वो एक दूसरे के साथ मिलती जुलती भी हैं. समटाइम्स दे लाइक हाई स्टेक्स और समेटिव जो होती हैं वो एक ही टाइप की होती है. लो स्टेक्स और फॉर्मेटिव एक ही टाइप की होती हैं. सो इफ यू सी समटाइम्स देयर डेफिनेशंस एंड कैन बी लाइक ईच अदर. तो इस पे कंफ्यूज होने की बात नहीं है. बस ये इसी तरह से है. बस ये आपको पता होना चाहिए कि किस सिचुएशन में आपने कौन सी असेसमेंट टाइप इस्तेमाल करनी है. दैट्स व्हाट वी शुड बी डू एज curriculum planners. So this is self-assessment, and because your goal is to develop in the student self-awareness and reflection, so the student is self-assessing himself or herself, and peer also because the peers are also giving a feedback on that as well the teacher is doing it. So this is the third scenario.
सर जो काम ये कर
So fourth case scenario is, can someone read this out please?
You are an instructor for third year medical students who are about to start their clinical skills training. Before you begin formal teaching, You want to understand the student's current level of competency in basic patient interviewing and examination skills. What is the recommended assessment type?
Diagnostic or
Diagnostic.
Yes,
Diagnostic.
diagnostic.
Low
diagnostic है sir.
Yes, right.
It is
It is diagnostic because ये उन्होंने उनको आप टीच करने से पहले जो है you are assessing them that उनकी कैसी interviewing examination skills है. So these were my references. Before we move on, let's revise a little. We defined assessment, and then we defined both formative, and which was during the study, and summative at the end of the study. And then we did the high stakes assessment, which are which are necessary for the students to pass, and low stakes assessments, which are more for the student learning. And after that, we did activity on diagnostic, norm, and criterion based, and peer assessment and self assessment. And then we did 4 case scenarios, and we chose the best type of assessment on them. So, any more questions, please ask. Any questions? Okay. Yes, Dr. Shabir.
My question is, can we mix the purposes of assessment in a single type? Suppose if I can take one assessment and I can use it for both summative and formative purposes.
Yes, purposes you can combine as well, because as Professor Zia stated, purpose is the same. Assessments have the same purposes. They are these, what I taught you are just the types of assessment.
Thank you very much.
Welcome. Any other question?
Madam, what are the current challenges of assessment in medical education and how to address this issue?
Challenges. Well, for example, in KMU, it is we have been introduced in MCQs have been introduced, so that they can be students ज़्यादा हो गए हैं तो MCQs इसलिए कर दिए हैं so that they can be checked easily. SCQs जो होते थे it was taking more time, results अक्सर डिले हो जाते थे, तो इस तरह के challenges हैं. फिर जो है sometimes मेडिकल एजुकेशन की जो एंट्री टेस्ट जो होता है उसमें जो है वो बिकॉज ऑफ द चीटिंग स्कैंडल्स, सो नॉर्म जो है वो हायर हो जाता है, तो कॉम्पिटेंट पीपल कैन नॉट गेट इनटू मेडिकल कॉलेजेस. सो देयर आर मेनी चैलेंजेस, एडमिनिस्ट्रेटिव चैलेंजेस हैं, फैकल्टी के कुछ बेंची ट्रेन नहीं होते हैं, स्टूडेंट्स के चैलेंजेस हैं, ये सब चैलेंजेस हैं. सो दैट इज अ बिग डिस्कशन. So I don't think we have the time for that. Any other question? Okay, thank you very much.
Okay. Thank you, Dr. Najia, for enlightening presentation and nice activities. Now I would like to invite Professor Dr. Sophia Kabir, who is currently serving Community Dentistry Department at Sardar Begum Dental College, to come and share her insights on the utility index. Madam, please take over the
नहीं
screen.
ऑफ है हाँ
Participants कुछ ऐसे हैं जिनके कैमरास भी बंद हैं, so we don't know that they are present in the workshop or not. तो please अपने कैमरास ऑन रखें because we can make sure कि आप participate भी करें. Thank you.
Assalamu alaikum. Thank you, Dr. Nashad. Thank you, Dr. Saleh. Thank you, Najia. And thank you, sir, Dr. Zia Saab, for making this workshop doable, and alhamdulillah. Today, I'm going to discuss about the utility index. As we were talking about the assessments, I'm Sophia Kabir, and I'm from DHPE first batch. So as we are talking about the assessments, so the most technical area is the utility index and the blueprints. As we all know that for us, for our country and for this province, assessments are a quite big challenge at the moment, the curriculum, but now the assessments, because we have to look into different aspects, the feedback from the students, and also to see how we assess the students and how we evaluate them according to their performances. So for making different assessment tools, it is very important to see how good they are, how effective they are, how cost effective they are, how reliable, valid, and educational impact does it have, educational impact as well. So for that, the ground rules Dr. Najia has already highlighted, so I think I should not go into that detail, but the learning objectives for the utility index are to describe the utility index, understand and calculate the additive and multiplicative models. Sorry, there is a correction over there. Analysis to analyze the usefulness of the utility index as well. So नहीं शेयर हुई? मैंने शेयर तो की थी, शेयर है जी ऑलरेडी। आपको नजर नहीं आ रहा जी? नहीं आ रहा?
आ रहा है नजर आ रही है मैडम।
ठीक हो गया। Okay. So what is utility index? Basically, everybody, we all want to know about it because it's quite new, not new, but it's the area where we struggle a lot because we are assessing the assessment tools. So for that, utility index is very important, which is a conceptual framework to evaluate the overall effectiveness or utility of an assessment method in educational setting, particularly in our field. So utility index is a significant outcome measurement. It will give us cost, utility, and cost effectiveness of the assessment models. We can also call them usefulness of the assessment tools. And basically, the components which we discuss or which we assess are basically, we call them products of the assessment tools. And what are these key components? They are basically educational impact, which is represented as E, R for reliability, V for validity, A for acceptability, cost effectiveness, and F for feasibility. So these are the areas which are very important to make your assessment tool effective, cost effective. All these areas should be there. So they contribute to the value of an assessment, all these components. And this is the formula which we are going to calculate how we assess or we evaluate our assessment tool. So it is basically the multiplication of all the products which will eventually give us the utility index. So what we are going to do is that we just want to know how it works basically. So it's just an example of an exam which is a summative exam, whatever sort of exam is that. So when you want to see the reliability, it should be consistent scoring among the students. So make it moderate. So you make it moderate over there when there is consistency of the scoring. How it's going to be valid? When you measure the knowledge outlined in the objectives. So it will give you a good utility index score. Acceptability, the student find it fair and it is acceptable by the students and the teachers. What is cost effective? that relatively inexpensive to administer. Naturally, when there are limited resources in the country which we live in, so we cannot afford too much expensive assessment tools. So for that, it is very important that they should be inexpensive, and then eventually it will give us a good utility index for cost effectiveness. And it should be feasible, easy to organize and implement. These are very important areas that we should consider to make our utility index more effective. So how it works in the education and how important it is in the education. So basically it helps the educators to choose or design assessment methods that are not only valid or reliable, but also practical, acceptable, and feasible. The same things which we discussed here, basically. So it's the same things in a paragraph, so you would be able to understand. And so now we're going to start with an example of OSCE. I wanted you to understand how this utility index basically works in terms of these all products, the 6 products which or the components which we just discussed before earlier. So I just want you to understand how in OSCE it is important to use to assess or to evaluate this method for the utility index. So this is the scenario that to develop, इसके बाद हमारी एक activity होगी, so it's very important that you should understand this scenario. So to develop a utility index for an assessment method that is OSCE, for undergraduate dental students, the components for reliability, validity, educational impact. Educational impact is basically their behavioral, their cognitive areas, how good they are, and acceptability, cost effectiveness, and feasibility will be considered. So the stepwise guide is that in the beginning we are going to first naturally define what OSCE is. So OSCE is basically you assess the clinical skills, or what happens in this clinical skills. You want to see the performance of the students in that particular task, what you have given to the students. And वो diagnostic भी हो सकता है, it can be procedural, or examination of this patient भी हो सकता है. But the most important thing is that it is time bounded, and you should know that it should finish in time. So for that, the next step is to analyze each component. So अब भाई हमने OSCE का करना है, हमने एक scenario बना लिया है. अब now we're going to see the reliability of that scenario. Whether the question is whether that OSCE is consistent. That is very important for reliability. और हमने क्या consider करना है to improve the inter-rater reliability. और फिर उसके बाद हमने we have to have a well designed and cover diverse clinical competencies. सारी देखनी है, and it should be in a uniform manner. और उसके लिए हमने एक्शन क्या लेना है कि we should have an inter-rater reliability check. और किसकी करने है? Examiner, to ensure that the stations are piloted. Beforehand, you ask the student to start with OSCE. It's very important to you. You should do the pilot of that particular OSCE, whether it is doable, whether it is reliable, whether the examiner can collaborate, whether there is a consistency in the results as well. So after that, you rate it a moderate or higher. Then you will say, yes, this OSCE is reliable. For the next is validity. We do the same. We ask question, is it accurately assessed? The clinical skill जो हम देख रहे हैं, उसकी knowledge कितनी है, उसकी competencies कितनी है. And then we consider different areas that it represents a real world scenario, and it is content validity उसमें है, जैसे communication, clinical reasoning वो हो सकती है, ये competencies बीच में हैं. And to assess the broad range of skills, बाकी और भी इंटरप्रिटेशन है जो बहुत बड़ी स्किल है, उसमें आप प्रोसीजर्स हैं, You want to see the different procedures, how you going to explain them. क्या ये चीजें उसमें हैं कि नहीं है? Incorporate input from subject expert कि उसने उस चीज में काम किया है, उस subject expert ने वो OSCE में अपनी input दिया है, and then he knows, or then the OSCE is according to that particular for that particular students or the participants, and regular review and refinement of that OSCE is very important. So we see that is there a blueprint for that particular OSCE? The blueprint Dr. Saleh is going to explain in detail. So वो चीज वो है, competencies हैं, feedback आपको मिल रही है, periodic reviews मिल रहे हैं. Are all these things incorporated or are there in that particular OSCE? So we give it a high. That is a very good OSCE. It has the validity. For educational impact, we see the contribution positively of the student in which aspect? The learning and developmental of the clinical competencies. Are they present in that particular OSCE? और वो कैसे हम देखेंगे कि टीचिंग प्रैक्टिकल स्किल्स कि वो रियलिस्टिक पेशेंट उस सिनेरियो में वो कर सकते हैं, फॉर्मेटिव फीडबैक है, सेल्फ डायरेक्टेड लर्निंग उसमें वो कर सक रहे हैं, वीकनेसेस तो नहीं है, आर देयर स्ट्रेंथ्स मोर एंड लेस वीकनेसेस, ये सारी चीजें वी हैव टू कंसिडर, एंड देन वी हैव टू see whether the teaching they can clinically basically can they teach that those particular circumstances they have proper communication, ethical decision making इसमें है, pupils जो हैं उनकी feedback वो encourage कर रहे हैं, reflection हो रही है, ये सारी चीजें आपने उस OSCE में देखनी है. अगर वो हैं तो it is educational impact high, it has that high impact. And then the acceptability for that, the same, the student and the faculty, it is appropriate, and are they okay with that, they accept it, and फिर उसकी feedback opportunities उसमें हैं कि नहीं है, and then you see pre-exam orientation sessions for the student and feedback session for the faculty of to increase acceptability आपने करनी है. अगर वो कर लिया आपने तो आपने उसको acceptable बना लिया. So it is very important that the OSCE should be acceptable by the students and the faculty members. And it should be obviously affordable. And for that, you have to consider that the whatever the OSCE is, it is cost effective and it is justifiable. And for that, you have to see the clinical infrastructure, the equipment, the time, the examiners, how many examiners are there, the rotation, this expenses, everything. So that will make it a moderate, because there is expenses over there, so you can't make it high. कुछ ना कुछ expenses होते हैं वहाँ पे. Feasibility में आप ये देखते हैं कि implemented within the available time, space and personnel, आया वो implement हो सक रहा है कि नहीं? There is a sufficient clinical space for the examiner to conduct that particular scenario, और वो logistic है कि नहीं, उसमें वो station, वो student का flow, उसमें कोई restrictions तो नहीं आ रही हैं. So that is very important. जब ये सारी आप चीजें देखेंगे, naturally administrative staff will play an important role over here, because it is very important to have a proper space for the OSCE to be conducted. So जब वो ठीक होगा, it runs smoothly and consistently, so you give it a high rating, which means that OSCE has a high feasibility. So when all these areas, reliability is moderate to high, validity is high, acceptability is high, cost effective, moderate, and feasibility is high, so you make this utility index a high utility index, because all the components, all the products are in a moderate to higher level. So you make it a point that it is an effective and cost effective OSCE. And naturally, for the fourth step, what we do is after the components are analyzed, we then modify for improvement. And what we do is naturally regular sessions of the examiners to enhance the scoring, consistency, to look at the consistency as well, cost effectiveness, ye sari cheezein, and the clinical, the infrastructures, everything should be seen and should be corrected or should be enhanced for the next scenario. So before going towards the practical table, I just wanted to give you a bit of an idea what is additive and what is multiplicative model. Basically, when you add the numbers, which we're going to do in the next slide, so it is basically all the elements or all the products, all the components are independent. You add one number to another number, which means one number has a value and it is added to the other number, so they are independent, both the numbers. So that is how additive model should be like. And you can score it. It is the low score in one area can be offset by a high score in another area. But in this particular MCQs, आप इसमें अगर feasible है और आपकी feasible validity और reliability है तो naturally वो उसको independently scoring करेगा, वो उसको independently देखेगा, calculate करेगा कि MCQ किस लेवल का है. और मल्टीप्लिकेशन में ये है कि वो डिपेंड करता है रिलायबिलिटी, वैलिडिटी पे, एजुकेशनल इम्पैक्ट पे, ये सब एक दूसरे पे रिलाई करते हैं, एक दूसरे पे डिपेंड करते हैं. सो इफ वन स्कोर इज 0 तो होल utility index will be 0 because it is affecting the complete utility index numbers. So multiplication में ये है कि एक नंबर नहीं होगा तो दूसरा नंबर उसको इफेक्ट होगा, वो उस पर डिपेंड करता है. अगर हम 2 + 2 करें तो 4 होगा, लेकिन 2 होगा तो 4 बनेगा, अगर वो 0 होगा नेचुरली वो उसको इवेंचुअली 0 कर देगा. तो मल्टीप्लिकेशन और एडिशन में ये है कि अगर 0 होगा तो एटलीस्ट आपको 1 तो मिल जाएगा, लेकिन अगर मल्टीप्लिकेशन करेंगे तो वो सबको 0 कर देंगे. तो ये बेसिकली और ऑस्टीज में हम ये देखते हैं कि हम सारी चीजें हमारी दे शुड बी इन इट्स प्लेस, ऑल द कंपोनेंट्स. So this is the activity which I want all of you to, if one person could read it loud and should, because it's just close to whatever I've just presented, so मेरे ख्याल में easy हो जाएगा. स्लाइड मेरे ख्याल में कहीं गायब हो गई है. I don't know किधर चली गई.
इससे पीछे
नहीं ये स्लाइड मेरी
एक्टिविटी आ रही सर, एक्टिविटी
डिलीट हो गई है शायद.
ओहो,
अभी तक थी और वो अब गायब हो गई है.
कंट्रोल Z कर ले तो वापस आ जाएगी जी, अगर कहीं पे डिलीट हुई है तो कंट्रोल Z.
ये वाली स्लाइड, आई डोंट नो व्हाई इट्स नॉट शोइंग ऑन द, ये पहले आप देख लें. आपको नजर आ रहा है सबको? इसमें MCQs, SEQ, OSCE, उसके लिए utility index बना है. These are the numbers for validity. ये एग्जाम्पल है, hypothetical एग्जाम्पल है. Validity MCQs की 1 है, जो ये reliability है वो 2 है, educational impact 2 है, cost effective जो है वो 3 है, feasibility 2 है, acceptability 1 है. जब आप इसको प्लस करेंगे तो आपको नंबर, हमारे जो कंपोनेंट्स के मार्किंग है, हम फेयर से एक्सीलेंट की तरफ जाते हैं. सो इफ इट्स नॉट गुड नेचुरली यू हैव टू मार्क इट 1, एंड इफ इट्स एक्सीलेंट इट इज गुड, सो यू हैव टू मार्क इट 3. इन बिटवीन गुड है जो एक किस्म का एक आपको मॉडरेट से इफेक्ट देता है. सो इट डिपेंड्स कि आपका MCQ किस लेवल का है. आप ये देखेंगे सारा कि उसकी कंसिस्टेंसी कैसी है, उसकी वैलिडिटी कैसी है, उसका इंफ्रास्ट्रक्चर कैसा है, अफोर्डेबिलिटी कैसी है, उसकी इम्प्लीमेंटेशन कैसी है, एक्सेप्टेबल है नहीं है, तो उस सब को देख के आपने उसकी मार्किंग करनी है। जब आप उसकी मार्किंग करेंगे तो फिर वो आपको एक टोटल देगा। टोटल अगर मल्टीप्लिकेशन कर रहे हैं, अगर डिपेंड करता है, नेचुरली ये एक डिपेंडेबल वो है जो यूटिलिटी इंडेक्स को शो करता है आपकी मल्टीप्लिकेटिव एरिया को, और ये आपकी एडिटिव एरिया को शो करता है। तो ये आपको बताता है कि आपकी यूटिलिटी इंडेक्स किस पोजीशन में है। अगर आप सबको देखें तो सबसे खराब जो यूटिलिटी इंडेक्स जो एसईक्यूज में है वो बन रहा है, क्योंकि बिकॉज देयर इज समथिंग रॉन्ग इन द मे बी इन द वैलिडिटी, इन रिलायबिलिटी, and naturally in the acceptability is not acceptable by the students or the faculty members. तो वो सारी चीजें आप लोगों ने देखनी है, उसके बाद आपने इसकी स्कोरिंग करनी है। रिफ्लेक्टिव पोर्टफोलियो का अगर आप देख लें तो उसका सबसे अच्छा बन रहा है, बिकॉज एवरीबडी, ऑल द स्टूडेंट्स, दे वांट टू गिव देयर फीडबैक to their teachers, and every teacher wants to take a feedback from their students to know to improve their teaching for the students. तो उसकी तरह उसकी वजह से आपके यूटिलिटी इंडेक्स जो रिफ्लेक्टिव पोर्टफोलियो का बनता है, so that is more than the other areas. So ये अब हमारी एक्टिविटी आई है और इसको आप देख लें, तो अगर कोई इसको पढ़ ले तो ज्यादा अच्छा है।
Your institution is considering introducing a new tool to assess patient communication skills. The options include a standardized patient interview and a written reflective assessment. Using the utility index criteria, including validity, reliability, feasibility, educational impact, and cost effectiveness, recommend which tool would be most suitable for evaluating patient communication skills in dental practice. It should be students' communication skills and dental practice.
Mic off है ना?
You will have 10 minutes to make and justify your recommendation. The scoring for each criteria can be on 1 to 3 scale, where 1 is fair and 3 is the excellent.
तो ये दो आपके टूल्स हैं, एक आपका स्टैंडर्डाइज पेशेंट इंटरव्यू है, एक आपका रिटन रिफ्लेक्शन है। अब आप ये सोचें, अपने इंस्टीट्यूट की तरफ सोच लें कि आपके क्या क्वेश्चन बनते हैं माइंड में, और आप उसको, आपका मेन क्वेश्चन क्या बनता है सब रिलायबिलिटी सब चीजों के लिए, और आप उसको में क्या कंसिडर करना चाहते हैं और क्या आपको ठीक करना है उसमें, ताकि वो उसकी रेटिंग अच्छी आए, या अगर नहीं भी है तो क्या रेटिंग देंगे उसको आप। तो इसके लिए अगर आप ये ऐसे टेबल बनाएं एक, और दो चीजें हैं यहाँ पे, अपना ये एक टूल बना लें, यहाँ दूसरा टूल, और उसकी मार्किंग कर लें और टोटल कर लें। जरा देखिए कौन सा वाला आपका ज्यादा अच्छा है, आप देख लें आपके उसमें कौन सा क्वेश्चन माइंड में आता है और आप उसको कैसे कंसिडर करते हैं। आपके पास 10 मिनट्स हैं जी।
मैडम ये जो कंपोनेंट्स है, वैलिडिटी, रिलायबिलिटी और जिस तरह फॉर्मेट्स ऑफ असेसमेंट है, तो ये टेक्स्ट रहेगी या कॉन्टेक्स्ट टू कॉन्टेक्स्ट वेरी करेगी?
सर आप मेरे
मिसाल के तौर पर अगर फर्स्ट ईयर का स्टूडेंट है, उसके लिए मैं रिफ्लेक्टिव पोर्टफोलियो की जो इम्पैक्ट है या इसका यूटिलिटी इंडेक्स निकालना चाहता हूँ, वो उसी तरह रहेगा जिस तरह फिफ्थ ईयर के स्टूडेंट्स के लिए है, या इसमें चेंजेस आएंगे? कॉन्टेक्स्ट
असल में अगर आप देखें तो, अगर आप देखें जी, मैंने पेशेंट कम्युनिकेशन के बारे में बात की है, तो पेशेंट कम्युनिकेशन
जनरल है। नहीं उस कॉन्टेक्स्ट में नहीं पूछ, मैं जनरल ये पूछ रहा हूँ कि जो हम कहते हैं कि एमसीक्यूज की वैलिडिटी अच्छी है या रिलायबिलिटी अच्छी है या पोर्टफोलियो की जो है ना वो इम्पैक्ट अच्छा है, तो ये कॉन्टेक्स्ट टू कॉन्टेक्स्ट वेरी करेगा या इफेक्ट्स रहेगा?
नहीं जी, वेरी करेगा, डेफिनेटली वेरी करेगा, क्योंकि हर एक एरिया में या हर एक प्रोडक्ट में आपका फर्क वो बनता है, आपके क्वेश्चन ही फर्क आते हैं वहां पे। आप उसको दूसरे के साथ नहीं वो कर सकते हैं। लेकिन अगर आप फिर यूटिलिटी इंडेक्स को आप मल्टीप्लिकेटिव बनाएँगे तो वो डिपेंड करेगा एक-दूसरे पे। उनकी वैल्यूज़ में चेंज नहीं, वो जो आपकी हैं एमसीक्यूज़ अगर आपका बहुत अच्छा है, तो वो उसी तरह आएगा। अगर वो अच्छा नहीं है, डिफरेंट एरियाज़ में ठीक नहीं है, तो वो उसको आप उसी तरह लाएँगे। अगर वो उसकी कंसिस्टेंसी ठीक नहीं है, तो नेचुरली उसको वो अफ़ेक्ट होगा उस चीज़ को। लेकिन मल्टीप्लिकेशन और एडिक्टिव बेसिकली आपको इंडिपेंडेंस और डिपेंडेंस की बात बताता है कि यूटिलिटी इंडेक्स कितना रिलाई करती है अगर वो एक दूसरे पे डिपेंड करें, और अगर इंडिपेंडेंट है तो उसमें कुछ चीजें कंपोनेंट्स आपकी अच्छी होंगी, लेकिन कुछ चीजें जो खराब है उसको आप अच्छा कर सकते हैं। आई होप मैंने आपको एक्सप्लेन कर दिया जी।
Thank you, madam. Thank you.
May I ask a question from the participants just for critical thinking? अगर आपके
Yes,
हाई स्टेक्स एग्जामिनेशन है तो वहां पे आप मल्टीप्लिकेटिव मॉडल पे जाएंगे या एडिटिव मॉडल पे जाएंगे? जिस एग्जाम्स का इम्पैक्ट बहुत इन्फ्लुएंस करता है, कॉन्सिक्वेंसेस बड़े ग्रेव और अदरवाइज हो सकते हैं अगर गलत रिजल्ट्स आए, तो आप मल्टीप्लिकेटिव मॉडल पे जाएंगे या एडिटिव मॉडल पे जाएंगे?
अगर
मेरे
एडिटिव
ख्याल
आप
में
जैसे
multiplicative will be too aggressive. Additive would
ओके,
be
आप
more
अपने
feasible.
स्टेक्स को भी देखें ना, हाई स्टेक्स एग्जामिनेशन है आपके, तो फिर इस पे जरा सोचें कि कहाँ पे आप रिस्क ले सकते हैं, जीरो किसी भी चीज के जीरो होने का रिस्क ले सकते हैं आप।
मल्टीप्लिकेटिव रिलायबल होगा। मल्टीप्लिकेटिव
yes ठीक है, आप until and unless you reach minimum standard for that multiplicative to make it help cross the border of required competency, ठीक है, जहाँ पे एक भी कंपोनेंट पे वो लैग करेगा ना आपका हाई स्टेक एग्जाम, उसकी वैलिडिटी कम होती जाएगी।
जी, थैंक यू डॉक्टर सोफिया, इट वाज अ नाइस प्रेजेंटेशन। मेरे दो क्वेश्चंस हैं। पहला क्वेश्चन तो ये है कि जो आपने इंटररेटल रिलायबिलिटी की बात की, तो ये हम कैसे, हाउ विल वी असेस, और इसके वैल्यूज कौन से आएंगे जिसकी वजह से हम ये समझेंगे कि इट इज रिलायबल और इट नीड्स इम्प्रूवमेंट। और दूसरा क्वेश्चन जो है वो आपने कहा था कि इसको कॉन्स्टेंटली वी हैव टू रिव्यू और ऑस्कीज, तो इसके लिए कोई बेंचमार्किंग होगी या नहीं? फॉर एग्जांपल जिस फैकल्टी ने ऑस्की बनाया हुआ है तो वही उसको साल बाद दोबारा चेक करेगा, और इस देयर विल बी कोई इंटरनल बेंचमार्किंग या एक्सटर्नल बेंचमार्किंग इसकी होगी फॉर इम्प्रूविंग, या आप कोई और तरीका इस्तेमाल करेंगे? थैंक यू।
सबसे पहले तो जी, जब आप रिलायबिलिटी वैलिडिटी को देखते हैं तो हम ये भी जैसे मैंने उस वक्त कहा कि रिलायबिलिटी में आप कंसिस्टेंसी को ज़रूर देखेंगे। जब कंसिस्टेंसी आपकी लो होगी, उसमें कंसिस्टेंट नहीं होगा आपकी रिजल्ट्स और आपका असेसमेंट का वो जो है वो ठीक नहीं आ रहा, तो और वो 1 है तो उसको इम्प्रूव करना है आपने। वो चेंज हो सकता है, वो ज़रूरी नहीं है कि वो कंसिस्टेंट हो। आजकल हम इन्हीं चीज़ों पे लगे हुए हैं सब कि हम अपने एग्ज़ामिनेशन जो असेसमेंट टूल्स हैं उनको इम्प्रूव करें। तो यही वो एरियाज़ हैं जहाँ पे हम लैग कर रहे हैं। कहीं पे कंसिस्टेंसी नहीं है, कहीं पे इम्प्लीमेंट प्रॉपर नहीं हो रहा है, कहीं पे एक्सेप्टेबिलिटी नहीं है, कहीं पे अगर आप देखें उसकी वैलिडिटी ठीक नहीं है कंटेंट्स की, कहीं पे आप एक्सपर्ट्स जो बेसिकली जो जिनको बनाना चाहिए उन्होंने बनाया ही नहीं है उस डॉक्यूमेंट उस सिनेरियो को, तो इवेंचुअली वो फिर स्टूडेंट्स के लिए डिफिकल्ट हो जाता है और प्लस एग्जामिनर के लिए भी डिफिकल्ट हो जाता है कि उसको वो कैसे असेस करेंगे। तो इसके लिए रेगुलर जो आपने जो बेंचमार्क वाली बात की, तो उसके लिए एक्सपर्ट्स का होना बहुत ज़्यादा ज़रूरी है, और एक्सपर्ट्स होंगे और साथ में स्टेक होल्डर्स होंगे, और नेचुरली डीएमई जो डिपार्टमेंट है उनका होना बहुत ज़रूरी है ताकि इस चीज़ को हम इम्प्रूव करें, स्ट्रेंथन करें, इफ़ेक्टिव करें। और उसके लिए हमें इन चीज़ों को समझना है, इन components को समझना है, इन प्रोडक्ट्स को समझना है कि where they should be improved, what areas are lacking and what areas are deficient. ये सारी चीज़ें बहुत इम्पोर्टेंट है हमारी एक यूटिलिटी इंडेक्स को हाई या इवन मॉडरेट में लाने के लिए। तो जब तक कंसिस्टेंट नहीं होगा तो रिलायबल नहीं हो सकता है वो। जब तक वो एक्सेप्टेबल नहीं होगा तो उसको हम कैसे एक्सेप्टेबल करें, जब तक वो इम्प्लीमेंट नहीं होगा तो स्टेक होल्डर्स उसको वो नहीं करेंगे, एक्सेप्ट नहीं करेंगे, तो वो उसको हम फिजिबिलिटी कैसे लाएंगे उसकी। तो ये सारी चीजें जी बहुत इंटरकनेक्टेड हैं एक दूसरे के साथ। तो और मेरे ख्याल में सब इस चीज पे अब स्ट्रगल करेंगे कि यूटिलिटी इंडेक्स किसी का भी इतना खास वो नहीं है। हम सब एमसीक्यू बैंक के लिए कर रहे हैं, लेकिन वही वाली बात कि ऑस्कीज को कोई नहीं समझ रहा है कि ऑस्कीज का क्या लेवल है। उसमें मल्टीप्लिकेटिव एस्पेक्ट आ जाती है, क्योंकि उसमें काफी एरियाज हैं, सारी एरियाज जो हैं बहुत इम्पोर्टेंट हैं कि इंफ्रास्ट्रक्चर कैसे होना चाहिए, टाइम कैसे होना चाहिए, कंसिस्टेंसी कितनी होनी चाहिए, एक्सपर्ट्स का होना जरूरी है। तो तब ही वो पूरे ऑस्की को एक इफेक्टिव बनाएगा। तो ये सारी चीजें हैं जिसमें हम स्ट्रगल कर रहे हैं अभी भी। तो मैंने अपनी तरफ से कोशिश की है कि मैं इस चीज को इतना वो करूं कि खुद भी समझूं और आप लोगों को भी थोड़ा बहुत आइडिया दूं कि यूटिलिटी इंडेक्स बेसिकली कितना इम्पोर्टेंट है हमारे लिए एज अ प्रोफेशनल उसका डेंटल एंड मेडिकल एरियाज में जो हम हैं, और हमें कितना इस चीज को इम्पोर्टेंस देनी है कि हम इस अपने असेसमेंट को इम्प्रूव करें।
May I add to it?
जी जी प्लीज।
सर ने एक सवाल पूछा है कि कौन से पैरामीटर्स हैं जिस पे हम इंटररेट रिलायबिलिटी देख सकते हैं। तो वन ऑफ द पैरामीटर्स इज द कोहेंस kappa and its value generally is falling between, if it's falling between 0.41 and above, it may be acceptable. Different parameters, other parameters are also used, interclass correlation, and some people may use the Pearson correlation as well. But the one of the correlation parameter which is used for the inter-rater's reliability is the Cohen's kappa. और सर ये जो आपने पूछा है कि मतलब उसको कैसे, तो एक जो एग्जाम हो जाती है उसकी पोस्ट हाक एनालिसिस की जाती है। पोस्ट हाक एनालिसिस में हम आइटम्स रिस्क कोरिलेशन एक चीज़ है उसको देखते हैं। तो उसमें हम वीक आइटम्स आइडेंटिफाई करते हैं जो बाकी आइटम्स के साथ कोरिलेट नहीं किया जाता, और फॉर सब्सिक्वेंट एग्जाम्स या उसी एग्जाम में हम उसको ड्रॉप कर सकते हैं ताकि उसकी रिलायबिलिटी अवेलेबिलिटी को इन्हांस किया जाए।
हमारा मेरे ख्याल में टाइम भी काफी शॉर्ट हो गया है, तो इसको हम मेरे ख्याल में वाइंड अप कर लेते हैं। आप इसको आपके साथ शेयर होगा तो आप इसको जरूर देखें। ये हमारा बॉक्स बना हुआ है जिसमें हम इसको असेस करेंगे। मैंने इसको ब्लैंक ही छोड़ा है क्योंकि हर एक इंस्टीट्यूट का अपना बनेगा, वो उसके मुताबिक इस चीज को असेस कर सकेंगे। हमने बेसिकली देखना क्या है कि did the student evaluate what tool better assesses communication skill? Yes or no? Did they consider which tool yield more consistent evaluation? Feasibility, did they assess the ease of administration for each tool? Did the student evaluate the tool assess effectiveness in enhancing communication? And cost effective के लिए did they consider the cost versus benefit for each tool? और फिर naturally हम देखेंगे कि students make a clear recommendation with reasoning, yes or no. तो eventually हमारे पास जो बनता है, तो हमारे पास है कि validity में हम high score tends to have a high score for direct assessing communication in a realistic context होता है, तो इसलिए हम इसको higher score देते हैं, while in reflective assessment may provide less immediate evidence of communication skill in practice. वहाँ पे हमारा इतना communication naturally नहीं होता। रिलायबिलिटी में हम देखते हैं कि स्टैंडर्ड पेशेंट इंटरव्यूज में वेरी करता है रिलायबिलिटी, इट डिपेंड्स ऑन द पेशेंट स्टैंडर्डाइजेशन। रिटन असेसमेंट में कैन बी मोर रिलायबल इफ द ग्रेडियंट रूब्रिक इज क्लियर। फिजिबिलिटी में हम देखते हैं कि इंटरव्यूज जो हैं दे रिक्वायर मोर रिसोर्सेज, व्हाइल इन रिटन असेसमेंट इट इज फ्लेक्सिबल हो सकता है, फिजिबिलिटी उसकी है ज्यादा है। एजुकेशनल इम्पैक्ट में इम्पैक्टफुल हो सकता है और जो असेसमेंट है उसमें लेस इंटरेक्टिव होता है एंड कॉस्ट इफेक्टिव नेचुरली कॉस्ट इफेक्टिव इंटरव्यूज में ज्यादा है एंड विद रिटन असेसमेंट आर मोर अफोर्डेबल बट मे लैक हैंड ऑन एक्सपीरियंस तो जब आप देखें तो इंटरव्यूज और रिटन फॉर्म में डिफरेंट एरियाज में आपको डिफरेंट उसका इम्पैक्ट पता चलता है कि कितना इफेक्टिव है कौन सा वाला. In conclusion, naturally the standard patient interview is better choice due to high validity and educational impact despite its higher cost and low feasibility. However, written reflective assessments can be beneficial as a supplementary or formative tool. ये basically presentation का वो था जी. Thank you so much.